So hopefully you've come up with a good organizational system for your last couple of weeks, or for last week with all your different classes. Okay? So today, couple things. I'd like to do the quiz, and then I'd like to go through the quiz. I like to do a lot of my teaching and lecturing from the quiz, because the quiz covers all different concepts from the last couple of weeks. Okay, so we'll do the quiz and we'll cover the quiz, and then we'll do some kind of updates I want to go through. I posted several announcements this week. I want to talk about all the different resources you have for preparing for your exam, all the Kahoots. I want to review the study guide with you, the review schedule this week. I want to go through the group, any questions on the group project. And then I want to go in and kind of give you a what I think is a good organization of the book, because you got a lot of chapters, right? And so I want to highlight some of the important areas of each chapter that I think you should review, because it's a lot of information in all these chapters. And yes, you need to read them, but there's also some important areas in each chapter that I think will benefit you greatly if you focus on those. Okay. And then we have time, we'll do a case study at the end. So that's how we're going to structure today. Does anybody have any questions? Does anybody have any? Go ahead.
I don't have a question, but it's kind of like you kept going in and out. I'm not sure if it was my computer or if it was anyone else. That's why you were talking.
I'm going in and out.
I'm having the same issue hearing you, Professor. It seems like you're lagging, similar to last week.
Hey, because I set up a whole new network for my internet, so
It's doing it now if you can hear us.
yeah, it's not skill. Okay. Okay. Well, thank you for that feedback. I'm not sure what to do here.
I have a question.
Yep, go ahead.
For the NCLEX questions, the categories you have, not all of them are on there for the 50 NCLEX.
Which categories are not on there?
Community health, and then the special populations.
Community health and special populations. All right. I have had some students already submit their NCLEX. Did you find, for the students that submitted it, did you find these omissions?
No, I just did what I saw.
And you did it from the announcement, correct? The announcement that gave the different categories for each week? Yes? Did you guys use the announcement when you were selecting your categories?
Yeah, and from the announcement, there's only spirituality, culture, and ethnicity, and communication are the only two topics from the announcements that's on there.
Yeah.
Okay, all right. I will look into that. Use what you have in your announcements for the categories you select. Okay, and then I'll get that sorted out. All right, so go ahead and pull up quiz 1. It should be available to you. And go ahead and start that. There is a 15-minute time limit. You got to stay on camera for the quiz. And then if you're done early, don't log off. If you need to go get a drink or something, that's fine, but don't log off. Okay, so go ahead and get that started. I'm going to make sure everybody's muted. I'm going to mute myself. And just give me a thumbs up if you have access to it. Okay. All right, so go ahead and get started on that.
It's asking for an access
Oh, password.
code.
Let me put the passcode in the, it's my last name. Let me put the passcode in the chat. Okay, I just did that. So it's Marvel, Marvel. All right. think we just have a few more students finishing up. Okay, looks like everybody's done. If you guys could all come back on camera, that'd be great. Please. How'd everybody do?
Terrible.
Not good.
Now, I'm making the assumption that everybody's watching the content videos, right? That you're given in your weeks 1 and 2 announcements, doing the readings. Okay, that's the assumption. Okay, let's go through the quiz and let's talk about some content. Like I said, I like to present a lot of my content when we review quizzes. I think it's a good learning activity, why the answers are right, why they're not right. So let me share my screen. And can everybody see my screen? Yes. I can only see a few people once I share my screen, so anybody can jump in to answer any of the questions. Okay. So one of the bases for this class is understanding the difference between community-oriented and community-based nursing. Okay, and I think it's chapter 1 talks about this. Okay, so this is from chapter 1. So before we even answer the question, what is the difference between community-oriented and community-based nursing based on your preparation? Anybody?
Communities provides care for individuals and families.
Community-based.
Community.
Right. Right. So community-oriented is the big picture. You're looking at large populations, the aggregates of populations. That's I think of it as orienting yourself to the community. All right, so you're looking at the whole population. Okay. Community-based nursing, I think of it as you're based in the community. You're taking care of individuals or families. Okay. Right? You're in a specific setting. So you could be the school nurse working in the schools. You could be the occupational nurse working in the work settings. You could be the hospice nurse working in the home care setting or a hospice center. Dialysis nurse. Right? So you're specifically working in the community with certain populations. So what would be the right answer here?
A.
Okay.
A. Okay. B, the rest of these are examples of community-oriented nursing. All right, where you're focusing on a large group in the community. Aggregates, which are populations. Aggregate means population. Okay, and D, that's looking at the community as a whole. So community-based nursing that focuses on acute and chronic care. Okay? So they may be peds nurses, they may be mom-baby nurses, they may be mental health nurses. So that is the big difference. Let me see if I have a better definition. Right, so illness care instead of the overall health promotion and health maintenance, what you look at in a community. All right, so it's individuals versus opposed to looking at whole communities. Does that make sense? So that's going to be our first understanding in this class is the difference of, are you working in a setting that's focused on the whole community? Looking at the whole community as a whole? Or are you working with specific subsets of the community in the based setting? All right. So again, that's how I remembered. Oriented, you're trying to get yourself oriented to the big picture, the big community. Based, you're based in the community working with acute chronic individuals. Okay. Okay. Number 2. First of all, let's define an aggregate. What's an aggregate?
Collection of individuals or a collection of people with similar characteristics.
Exactly. Okay. That's exactly what it is. An aggregate is defined as a collection of people who share one or more personal or environmental characteristics. Right? It could be children, could be elderly, could be the homeless, could be an aggregate, a specific set in the population, a vulnerable part of the population. Okay, so what would be the answer to this question? What's an aggregate?
C.
Right, a collection of people who share one or more characteristics. Okay, so that's the definition of the aggregate. Okay. Let's take a look at question 3. Nurses at a homeless clinic are concerned that homeless clients rarely return to have nurses assess the findings of their TB skin tests. Which of the following is the most appropriate policy for the clinic to have regarding the screening test findings? So, what's an important word in this question looking forward to your exams? If you were going to be reading this question in an exam, what would you highlight as an important word, phrase, term?
Most appropriate?
Most. Exactly. Because most is a priority. It's asking for what is the most appropriate answer. So what was the correct answer to this?
B.
B. Why is that the correct answer? What are some of the barriers with this population?
They probably can't afford like cell phones.
Exactly.
Transportation.
Transportation. And it is appropriate. to give them a postage paid card to have them mail that back in.
I have a
Okay?
question.
Yep.
In the case that they don't send it back, like, is there an alternate that you would do? Because, like, what if they don't remember to send it in? It's just,
Right. That's why this is a vulnerable population. So you may not see them until if they have a positive test, you may not see them until they come back. Right? Or have symptoms or present themselves somewhere.
So on
They
this
may.
one,
Mhm.
um,
Go ahead.
you're talking about how transportation might be an issue with that.
Mhm.
Um, I guess I'm confused on, are we as the policy, are they providing the like postage paid card and all that? Like the
Yeah.
facility? Okay, because
Yes. That's one way to encourage them to mail their test results back. Hopefully they will. But remember, this is a very vulnerable population. There may be too many barriers for them to accomplish that, but that's the best we could do. Right?
yes, thank you.
Mhm. Okay, which of the following actions demonstrates effective public health nursing practice in the community? This is a select all that apply question. So this comes from, again, chapters 1 and 2, where you're looking at community health, public health. What are the correct answers?
A and B.
A and B
And C.
and C.
see,
Okay, so in the community or in public health nursing, we are participating in epidemiological investigations. Okay, they're looking at potential health hazards in the environment. Right? We're also always looking at new services that can be organized where vulnerable populations live. And one of the things you'll learn over the course of the term of how important collaboration and partnerships are within the community, within that community nurse role. Right, so if you think of all the different kinds of vulnerable populations in the community, you think about what partners, what resources will be in the community for you to collaborate with. Okay. What do demographic figures suggest about the ways in which the population of the United States is changing? Again, another select all that apply. What do we know? We know that definitely foreign-born immigrant populations are increasing. That's a correct answer. We know the Hispanics are the largest minority group population. And the other is we know that mortality for both genders and all age groups has declined. C is not a correct statement. Does anybody have any questions about that? I know it's a lot of information to input in the first couple of weeks. Number 6, which of the following statements best explains why family functions and structures create unique challenges in family nursing? What's the important word in this question? This is another priority question.
Best explains.
It's asking you for the best answer. Okay, what do we know? What's the best answer for this?
A.
A. Exactly. We know that function and structure change over time. Okay, that's a given. Okay, function B is incorrect. Function and structure do apply to all family units. Okay. Okay, the nurse is making an appointment with a family for a nursing visit. Which of the following describes a potential barrier the nurse may encounter? So think about the family, whether, depending on how many people are living together, think about all the different factors that need to go in for a family visit. What would be a potential barrier?
Getting everyone present.
Exactly, because you do want everybody present, right? You do want everybody attending this family meeting. Okay, A is not necessarily true. You can do an assessment without all the extended family present. Okay, C, nurses have a limited time. That's not necessarily true. That's not a barrier. Okay, we do have the time to do our visits. And with D, families are often scattered over a large area, making it difficult. Yes. But with all the progression in telehealth, maybe others can be online. Part of that visit may be virtual for some members. Number 8. So a nurse has just met the parents of a 10-year-old child who's been diagnosed with a congenital heart defect. When interviewing the parents, which of the following would be a priority? Again, another important word. What would be the priority question for the nurse to ask? What's important in this question? What can you pull out of this question as important information that may lead you to the right answer? This question has a lot of information in it. What's important?
Having a medical home to provide care.
Right?
Congenital heart defect.
Congenital heart defect is going to potentially involve multiple resources. So what would be the best question to ask?
D.
Pardon me?
D as in dog.
D.
D.
Right.
I have a question.
Okay, go ahead.
I chose B, like, as in boy for this one because, like, nutrition could go into like heart, like heart issues.
Sure.
And like when it comes to children, like nutrition is really important.
Mm-hmm.
So
That's
why isn't that?
That's absolutely true. But what's the key word in this question? Priority. So this is a good example, and I'll talk about this more before we do exam prep. Okay, this is an excellent example of a question that more than one answer in your first read could be correct. Right? So let's say you came down to B and D. Okay, and then you reread the question and it's asking you what is the priority. Pardon me, it's not that B is not correct, but it wouldn't be the priority to ask first. Does that make sense? I talk about this over and over again with exam prep. Okay, this is a great example. So when you read through the question first and you come up with, oh, well, that looks correct. Oh, maybe that can be correct too. And it's not a select all that apply question. What do you need to do? You need to go back and reread the question to see if you missed an important word, phrase, cue. And Alexa, in this
Okay.
question, it would be priority. So it's not that your answer is not correct. It's just not the priority.
Okay, thank you.
Does that help?
Yeah, it does.
So what is a medical home? Let's talk about that. What's a medical home?
Like a primary care physician where they get services.
Exactly. That has all of their information, right? So now think about your problems. Think about whatever insurance you have. Typically, everything is contained in one place. So your primary care can look at all the reports from other doctors you've seen, other tests you've had, other services you've accessed. It's one area where everything is kept. That's considered a medical home. Okay, so if we know we have a client, a child, that has a congenital heart defect, and they may be utilizing multiple doctors or multiple resources, it's important to know, does this child have all their information located in one place, which would be a medical home? Does that make sense? Okay, which of the following must be firmly established before beginning a family assessment? And this is a select all that apply. Just think about in general terms, what do you need before you start an assessment?
Purpose.
Pardon me? Why? Why do you need the data? Right? What is the most convenient time for to visit the family? And what's the rationale for the visit? Okay? And B is not necessarily a priority. But when you're communicating with the family on why you're visiting, why they may want to know why the data is needed. They may come up with a time that's convenient for them so they can have as many people present. And then, of course, you want to discuss with them the rationale or the purpose for the visit.
Could why the data is needed and rationale or purpose of the visit be almost the same thing or similar?
Say that again, Alexa.
For A and D, aren't they kind of similar almost in a way? Like why the data is needed and the rationale or purpose of the visit almost?
They could be, but it is separate. I mean, why is it? Let's think of a scenario. Okay, I'm coming to visit to assess the environmental risks in the house. Okay, or I'm coming to assist with a child protection person to assess whether there's any neglect or abuse going on in the house. Right? So why would that data be needed? Well, maybe there's been a report made. Okay, so it is similar a bit, but it is also different. Does that make sense?
Yes, kind of. I just thought that like the rationale of it was similar to why the data would be needed for the visit, but I understand what you were saying in your example, your scenario though.
Okay. And the last question. Which of the following interventions would the nurse most likely implement when addressing the problem of asthma among school-age children? Again, what's the important word in this question? Most likely. Again, a priority question. Okay, so one of the correct answers is A. We would want to assess schools and daycare centers for environmental friendliness. What are the risks? And then the other correct answer is develop a home and environmental assessment guides. Okay, we wouldn't need to share nutritional information with all students at school, nor would we need to teach all personnel how to use a rescue inhaler. Okay. I'm going to stop sharing for a minute. Does that help? Does that give you a better understanding of that information?
Yeah, I just think that the answers were just so I think that they were very closely related, and that was like also very challenging on that quiz.
Okay.
Other than that,
I'm gonna
yeah, I just feel like the answers were really confusing.
Okay. I want to take you to the book. Okay, because you have a lot of reading. And before I get into any more content, I want to give you my 2 cents, if it's worth, for going through all these chapters. Because really, if you look at the whole syllabus, we're pretty much covering every chapter in the book. That's an entire book. So you really need to, I think, be able to pick out important parts of chapters that are going to facilitate your learning of the concept. Okay, so here goes this. I spent a whole bunch of time this morning and last night doing this. So I want to show you what I think you should tackle when you're attacking these chapters. Okay, definitely be watching the video, the content video, right? That's for sure. Okay, but let's okay. I'm going all the way back to chapter. Can everybody see my screen? Okay. All right. The first thing that I would be doing is looking at the objectives. Okay. After you go through the chapter, you should be able to answer these questions. Okay, so after reading this chapter, the student should be able to. Okay, so that's my first comment. Okay. I would, and this is just chapter 1, and I know I'm scrolling through, I get it. Doesn't mean that that you're not responsible for it. But there are certain things in each chapter. First is levels of prevention. There is a levels of prevention box in every chapter. Okay. Let's review primary, secondary, and tertiary. Here's the way I remember it. P, primary, is for prevention. S, secondary, is for screening. T, tertiary, is for treatment. Okay. So prevention, you're trying to prevent something before it even happens. Okay? Trying to prevent it before it even occurs. Whether you're trying to prevent an illness, an injury, injuries, let's say when I was in the schools, we did a lot of primary interventions with adolescents and kids on bike safety, wearing helmets. Just giving you some examples. With the adolescents, we did primary teaching on seatbelt safety. Okay, with the immunizations, trying to encourage families to get immunized for protection, for prevention of childhood diseases. All right, so you're trying to prevent something before it even occurs. Okay, secondary is screening. I also like to think of secondary, and I'm going through this in detail because this is going to come up in every chapter. Okay, I like to think of secondary as early identification, early intervention. You are screening for risk. Okay, so that's why we do mammograms. That's why we do colonoscopies. That's why we do blood pressure screenings. That's why we do blood glucose screenings. You're screening for risks. In the schools, we would screen for who's at risk for obesity. Okay, or who's at risk for substance
The kids that
abuse.
sit at home.
Pardon me?
You said who's at risk for obesity as kids?
Yeah, screening. We're screening. Who's going to be at risk for obesity? Who might be, I'm talking in my school experience, who might be at risk for substance abuse? Who might be at risk for behavioral problems? Right? It's all about screening. Okay? Because if you can identify risk, then you can do some early intervention. Maybe try and reverse course. Okay? Tertiary. The key thing about tertiary is something, you have to have something. Whether you've had an injury, maybe you've had a TBI, maybe you've had a stroke, maybe you've had a diagnosis, maybe you've had a condition, you've been diagnosed with a condition. It's all about treatment and management. Okay, so let's say you have somebody with hypertension, maybe you're working with them how to have a low sodium diet. Maybe if you have a group of people who are obese, maybe you're working with them with diet and exercise. If a client's being discharged from the hospital, has had a stroke, and you're going to be working with them in the community, maybe you're helping them access their resources for physical therapy, occupational therapy. You're trying to help them manage whatever's happened. Does that make sense? There is a levels of prevention box in every chapter. I highly suggest that you highlight this box in every chapter and read it. Okay, because we need to be able to apply primary, secondary, tertiary interventions to each of the concepts we're covering. Okay, so this particular box is public health nursing, and each box is going to be specific to the chapter that was covered. So these are examples of primary, secondary, tertiary with public health nursing. Okay, so that's my first tip for what to read in chapters. My second tip is, I think most of the chapters are going to have a Healthy People 2030 box. We reference Healthy People 2030 throughout the whole term. Here in chapter 1, it gives an overview of what Healthy People is. It talks about the history starting out in 2000, then we went to 2010, then we went to 2020, now we're in 2030. But as you'll see in the chapters ahead, Healthy People then identifies, for example, in the school nurse chapter in 31, the Healthy People box talks about what their goals and objectives are for school nursing. Does that make sense? So chapter 1 is the overview. but this is a good history of Healthy People 2030 and how it started. In this particular chapter, this is a good section you need to review. And I'm highlighting, what I want you to read, I've highlighted. So this is on page 12. You need to read the section on public health nursing versus community-based nursing. This gives you a more detailed understanding of community-oriented nursing versus community-based nursing. Community-oriented nursing is often used in synonymous with public health nursing. Okay. And here's a nice box. Here's a great summary right here, box 1.5. Page 13, difference between community-oriented, community-based. Okay. The other box that's going to be in every chapter that I would encourage you to review is your QSIN. Okay, QSIN stands for Quality and Safety Education for Nurses. Okay, these are a set of competencies. That's what QSIN is, competency. And the 6 competencies are outlined on the left-hand side. And this is because it's chapter 1, gives you the definition of each competency. As you go through each chapter, when this box pops up, it's going to pick one competency and talk about it in relation to that chapter, the subject matter of that chapter. So become familiar with these competencies: client-centered care, teamwork, collaboration, evidence-based practice, quality improvement, safety, and informatics. One of those are going to be highlighted in each chapter. Okay? Then the other very important area to read in each chapter is towards the end. It's usually right above the summary, is applying content to practice. Okay, because that's what we're doing. That's the whole next gen format, right? We're taking the content we've learned and applying it to practice. Okay, and each of these applying content to practice going forward, specific to each chapter, talks about how to apply the content from that chapter to practice, and it gives you scenarios. Okay, and then I always suggest you read the Remember This at the end. Just a set of bullets that gives you a summary of the chapter. So after reviewing those particular areas of the chapters, then I would go back and have a look at the objectives. Can you answer those questions? We jump to chapter 2. These are just your readings from this week. Again, I've highlighted the objectives. Okay. I'm not saying you don't have to read. I mean, you could breeze through this, but then get to the meat of the chapter. You don't need to worry so much about the history of public health nursing. But here's your Healthy People 2030 box. The history of the development of healthy people. Here's your QSIN box, focusing on the competencies. I don't know if this apply, and then you're applying content to practice. Okay, when you get into the first 3 chapters are really history, public health nursing, community-based nursing, but chapter 3 is an important chapter, and I want to review that, or parts of that, because what is evidence-based practice? Or I'm sorry, chapter 9. The first 3 chapters are pretty generic chapters. History of community nursing, history of public health, US and global healthcare. One of the things to know about, what did you learn about the United States healthcare? What did you learn? There's one really important aspect of it. We are, and I think I've highlighted that here, despite the fact that healthcare costs in the United States are the highest in the world and make up the greatest percentage of our GDP, right? The indicators of what constitutes good health do not document that Americans are really getting a good return on their investment, which means our healthcare is the most expensive and we're not getting the best results. Is anybody surprised by that? I want to jump to chapter 9. This is an important chapter, okay? Because this really defines how we practice in our profession. What is evidence-based practice? What is it? That's one of your objectives, define evidence-based practice. What is it? We think about it. We all are trying to practice evidence-based practice in our work settings.
Do you have clinical findings to back up like your practice?
You have what?
Clinical findings.
Essentially, you're using the current best evidence in making decisions about caring for your client. Whether that's come through control studies, whether it's come through clinical studies. Okay, our profession strives to use the most current, accurate, evidence-based practice to guide our healthcare. That's essentially what evidence-based practice is. Okay, we use the best evidence that we can get from a variety of sources, whether it's research studies, nursing experience and expertise. Okay. And here's some types of evidence-based practice that I've highlighted here. Okay. The RCT, the random controlled trial, generally is the highest level of validity. Okay, so that's the best evidence. Then here's a list of some other sources: non-randomized clinical trials, case control reports, qualitative studies. In nursing, we can use our nursing journals, published articles, professional guidelines, national guidelines. But my point is, there's a variety of sources to pull from to be up to date on the most current knowledge. Let's say, here's an example. Let's say 2 hospitals in a city were doing a research on how long the patient stayed after cardiac surgery. Let's say one hospital, they were able to discharge a patient in 5 days, where the other one had to wait 10 days. So you look at both of those models of both of those hospitals. What is the hospital doing that's discharging in 5 days? Do they have evidence that suggests that they can do it better, more, and do it safely and more costly? Right? So maybe that becomes the standard care, the standard practice. Okay? One of the first things you need to know in the process of evidence-based practice, obviously, you have to know what you're looking at. So are we looking, what's the clinical question we're asking? Are we asking, how to reduce patient days in the hospital. How do we care for clients that have had a stroke? Right? You have to have something that you're investigating for the best possible evidence. You always have to be asking those clinical questions. Okay? Here's our first example of using our levels of prevention in this chapter of evidence-based practice. Okay, so that's why I suggest you read these levels of prevention. And then you can look at what competency they're talking about with evidence-based practice. Okay, so the targeted competency for evidence-based practice, you take the best evidence with clinical expertise, taking into account whatever the client family preferences are for the delivery of your patient care. And then here's healthy people sharing their goals on evidence-based practice. Okay, here's their goals and objectives. Okay. So that's a quick introduction to the book. I know we just covered a couple of chapters, but that's how I've highlighted the book going forward. Pulling those important aspects out of every chapter. And then the applying content to knowledge, or what was it called? Applying your knowledge to clinical practice is a really important section to read in the book, because that gives you a general summary of how to apply the content you've just read, the content you've just learned into the practice setting. And that's what Next Gen is all about, right? Taking the content you learned, putting it into practice. I mean, look at your CJ Sims, right? They're patient scenarios, they're clinical practice. Look at questions on your HESI, questions on your exam. So much is clinical judgment, right? It's not a matter of memorizing anything and memorizing anything. You're expected to have that knowledge, right? And being able to apply it in the clinical setting. So does that help break down the chapters for you? Those are my best suggestions. Those are the most important parts of the chapter. But please remember to always go back and take a look at the objectives. Because those objectives, I would read those objectives, go find those areas in the chapter to be able to answer those objectives. Because those objectives are the most important information for you to understand, understand the concept of that chapter. Does that make sense? Couple more areas I want to cover for content before I review some of the assignments is we talk about social in part of this content. I think it's in week 2 with your family health risks. We talk about social determinants of health. What are those?
Socioeconomic status.
Yep, there's several. All right. Social determinants of health are broken down into 5 domains. And this is looked at with everybody. Okay, these are the basic 5 ones. Your economic stability. This is for an individual, a family, a community. Okay, so you look at economic stability, access to education, access to health care. What does your neighborhood look like? How is your neighborhood made up? And then the social and community context, which is what's available to support your community. All these social determinants will help you identify how healthy is the individual, How healthy is the family? How healthy is the community? Do you live in a community? Does your community have safe housing, transportation? Does it have safe neighborhoods? Is it a crime-ridden community? A lot of gang violence? Is there a lot of racism, discrimination that goes on in your community? Is there a large immigrant population? How's the education? Are kids meeting grade levels? Are kids graduating? Are there jobs? Is there high unemployment, low unemployment? What's the average income of your community, or of your family, of your individual? Do communities have access to nutritious foods? Do they have big grocery stores or small bodegas? What about the environmental issues in your community? Do you have polluted air? Do you have polluted water? Do you live near a big transportation hub? Do you live in an industrial area? Do you live in an agricultural area? And what's the language and literacy skills of your community? Do you have a high non-speaking English population? Do you have an issue with literacy? One of the big issues in community health we find is low literacy. Low literacy in general, low literacy about healthcare. Okay, so all these different social determinants of health help you determine when you're doing your assessments, whether you're doing an assessment with an individual, family, a group in the community, an aggregate group in the community, or the whole community. They all look different in every community, but they all have to be taken into account for, right? I mean, you just did, or you're doing, you haven't done your vulnerable populations, but you're going to get to pick a population in your community, do a research project on. These social determinants of health will play into that. Okay. We know that social determinants of health contribute to wide disparities and inequities, and we just mentioned some examples. Okay. Introduction to vulnerability. You have a whole chapter on that. Every community has lots of vulnerable populations. Right? Just think about your own zip code. Every community has kids, every community has elderly. These are vulnerable populations, has veterans, has homelessness, substance abuse, drug abuse, victims of violence, domestic violence, child abuse, non-English speaking people, mental health. All of our communities have that. And if you're out working in the community, you're going to be working with people with vulnerabilities, right? Resiliency. Let's talk about resiliency for a minute. What is resiliency? What is being resilient? This is part of our vulnerable populations discussion. What's resiliency?
Like even though you don't have like the best outcome, like you still make the most out of it, or you grow from stuff that is bad.
Yep. You keep fighting forward, keep pushing forward. You're resilient. Right? You're gonna not let these barriers take you down. You're gonna try and push through it, be successful, raise yourself up. And if you think about all these vulnerable populations in the community, they don't have a lot of resiliency. Right? So one of our jobs as a community nurse or public health nurse is to build up that resiliency. Right? The higher your resilience, the lower your risk. Right? Vulnerable populations with low resiliency are very high risk for a lot of things. But if we can help build that resiliency by, whether it's hooking them up with a doctor or getting them the resources they need, giving them the opportunity to rise up, maybe rise out of their vulnerable situation, get back on their feet. That's what resiliency is all about. Okay? Poverty with our vulnerable populations. We'll talk about this later in a later week, but I just wanted to introduce this. Poverty is the leading cause of vulnerability. Okay, if you think about it, think of all the areas of somebody's life and environment that living in poverty affects. What would you suggest? What would you throw out? What would poverty affect?
Access to healthcare.
Access to healthcare. What else?
Healthy food options. Lifestyle.
Pardon me, Emily?
Healthy food options.
Healthy food options. Education options. Maybe insurance options. Maybe stability of the family issues. If you have parents that are unemployed or one or more unemployed. But poverty is the leading cause of vulnerability. Okay. I want to shift to family risks. If we talk about that in week 2. Let me jump back. I want to talk about school nursing. That's kind of my expertise, but what does a school nurse do? That's your chapter 31 in your book. What do school nurses do? What'd you learn about school nurses?
They provide care at like sporting events and things like that.
School nurses can be direct caregivers, right? I know for me, I was a direct caregiver to many of our complex students. Trachs, suctioning, cathing, taking care of our diabetics, insulin shots, insulin doses in their pumps. Okay. School nurses are also health educators. We're educating everybody. We're educating the students, we're educating the staff, we're educating the administration, we're educating the parents, the community. We're managing the complex kids in the schools that require services, maybe speech, OT, PT, social work, psychologist. Okay, we're also doing a lot of community outreach, vaccination clinics, health fairs. Okay. Your school nurse chapter has an excellent box on primary, secondary, and tertiary interventions. I would highly suggest you read that in chapter 31. Okay. We're talk about functions and structure of a family. I know that came up on a couple of your quiz questions. Okay, there's 5 general functions of a family, and this is in your readings, but I'm pulling it out for you because I want to review it. Okay, we have functional families and we have dysfunctional families. Okay, so we look at that function and dysfunction within 5 areas. Okay, financial. Is the family planning for the future? Are they making good financial decisions? Do they have a house or an apartment? Is there a roof over their head? Second is health. Okay, are we teaching healthy behaviors? Are we modeling healthy behaviors? Third is reproductive, with regards to being able to be caring for the children that you have. Okay, so that's another function. Fourth is the socialization. Are we raising our kids to be good kids? Are we raising them to fit into society? To establish morals and values that are consistent with society? Are we raising them to role modeling to be responsible, productive members of society? And then the last one is affective, AFFECTIVE. Are we helping them create a sense of identity? Do we spend time together? Do we bond? Okay, if all those are functioning and doing well, you're probably part of a functioning family. But once there become issues in one or any of these, the risks of moving towards a dysfunctional family increase. Right, so those are your 5 functions that every family is looked at through that lens. They may be all great, they may not all be great, but that's part of when we do our family assessments. Okay, then when we're assessing the functionality of a family or the dysfunctionality of a family, those are the things we look at. Health risks come from 3 areas: genetics, environment, and behavior. Okay, everybody has health risks. Every family has health risks. Okay, genetic, exactly what it says. Hereditary, right? You may be predisposed to things, maybe heart disease, cancer, alcoholism, epilepsy, diabetes. That plays a part in families' health risks. Your environment, where you live, where you work, where you socialize, where you, do you live in a high stress environment, low stress environment? Do you live in a crime-ridden environment? Those all come with risk, right? And behavioral are the choices we make. Do we choose to eat healthy or unhealthy? Do we choose to consume a lot of alcohol or do drugs? Those are behavioral risks that we bring upon ourselves. Okay? I would like to go through a couple. Oh, I stopped sharing. Did I stop sharing? I stopped sharing. I want to go through just a couple of announcements to make sure you guys don't have any questions. Did anybody have any questions on the group assignment? I tried to make it as specific. I even listed out the case studies. So everybody's going to be, each group is going to be, there's 3 case studies in your announcement. Each group is assigned a specific case study. Okay. In your roster for this class, you should have the student emails. So somebody's going to have to take the lead and reach out to the group and say, hey, we're group alpha. We have case study 1. Who wants to do what? Right? Somebody's going to have to take the lead and coordinate. Okay. And your rubric is very specific on what needs to be in this paper. Okay. My suggestion is you get going early. It's due next Wednesday. So somebody, if you already haven't, needs to send out a group message and get it together. Then somebody needs to take the lead on send your information back to me. I'll put it together in the paper. But everybody, like I said here, everybody, I always get these questions, even though I put it in here. Everybody needs to submit a copy of the final paper. Okay, and that's so it flags your grade book so that there's an entry for that assignment. Okay. So does anybody have any questions about the group project? Exam soft practice exam. I encourage everybody to go into exam soft and do this quick practice exam. It's open for you. Okay, and there's a passcode, Fortis 01. This is simply to check the compatibility of the devices you're using with ExamSoft. Okay, I know you just used ExamSoft a few weeks ago. However, things can change. Maybe your device has changed. Maybe something has changed. But it's always good to spend less than 5 minutes going in here doing this ExamSoft practice exam. Okay, so before you get to your exam next Wednesday, I really would appreciate if everybody would go in and do that. And you access it through ExamSoft. Okay, preparing for exam 1, it's already next week. Okay, in this announcement that was titled Preparing for Exam 1, lots of resources below, you got to read that announcement. Has everything you need in there. It has the schedule. There's 4, maybe 5 live reviews. I think what's today, the 17th? I think they start tomorrow. No, there's one today. Professor Alani's doing hers tonight. There's one tonight. It looks like there's 2 on Thursday and 2 on Friday. So there's 5 opportunities for you to attend a live review. So I would really encourage you to try and get to one of those. You will end up getting all the recordings for all 5. I'll send out all the recordings. Okay? So you have plenty of opportunity to prepare for the exam. You also have your concept guide here. I pulled this up right here. This is your study guide, your concept guide. That's in that email, that announcement. It goes through all of the suggestions for getting ready for the exam. Okay, it's pretty long, but it's pretty specific on all the things. And these will be covered, I'm sure, in the reviews as well. Okay, so you have that. And then look at all these Kahoots you have. You have a week 1 and week 2 review. I would suggest prioritizing that Kahoot. You have one on public health. You have one on evidence-based practice. You have one on primary, secondary, tertiary, government agencies, school nurse, and you have one for exam 1 review. That's a lot of good Kahoots. And you know, Kahoots I used to do in class, you know, for the competition. If I have time to do Kahoots, I will do it. But if not, I also think Kahoots is a great individual activity as well. Okay, so you got some really great Kahoots. You have a ton of resources to prepare for exam 1 next week. Okay, and if you're going back and reviewing your chapters as part of your exam review, I would stick to what I guided you to in each of the chapters. So between doing that, going to an exam review or reviews, listening to the recordings, you've got your content recordings for the beginning of week 1 and week 2. You've just got a lot of resources. You really do. So everybody should be prepared for exam 1. You don't want to not prepare for exam 1, right? Because then you're waiting until week 6 for your next exam, and that's a long time to wait to bring up your grade. So I would really encourage you to put the time in studying for this exam, do well in this exam so that we start off good. And you certainly have the resources to prepare for it. Okay. So I know we covered a lot. Pardon me. I know we covered a lot. Helpful? Has this been helpful? Okay. I want to stick to what I said I would do with time. 10 minutes early because we're not taking a break. So I'm about a minute over. If anybody has any questions and wants to stay on after, that's fine. Otherwise, if anybody doesn't have any questions that are specific to the whole group, let's end the class, and I wish you a good week 2. Please reach out if you need anything. Okay, and next week at this time, you'll be taking exam 1. Does
Thank
anybody have
you.
any
Thank you.
that will benefit the whole class?
Have a nice afternoon.
Oh, thanks.
Thank
All right.
you.
Yeah, I'm gonna stop
You.
recording, and anybody that wants to stay on, please feel free to stay on. Okay, bye.
Bye. Thank you.
You're welcome.